So good morning, everybody, Your Eminence and your colleagues. Jeff, thank you for having me here today. It's so good to have the chance to see you all in person after 2 painful years of isolation. Discussing the linking between poverty and biophysical factors, of course, it's not easy to identify which one of the two components is the determinant of the other. Biophysical factors that have an influence on our survival, development, and evolution, such as soil, water, air, or good health conditions, are the same as those that influence wealth conditions. So in my few words today, I would like to focus particularly on health and access to healthcare, which is my background and my experience. So poverty is both a cause and a consequence of poor health, as we all know. It increases the chances of poor health, and poor health in turn traps communities in poverty. And infectious disease and neglected tropical diseases kill and weaken millions of the poorest and most vulnerable people each year, as we all know. And of course, the COVID-19 crisis has reminded us that our economies depend on our health, and our health depends on how we work together. And the COVID pandemic led to 97 million more people being in poverty in 2020. It represents an historical, unprecedented increase in recent times. While we are all still involved in the challenge of reaching a COVID-free world, we should acknowledge that despite major health gains of the past decades, new threats are emerging, including the resurgence of all the new diseases, the risk of new and future pandemics, and increasing global burden of non-communicable diseases. In fact, the latter account for over 70% of all deaths in the age group 30 to 70. According to the World Bank, more than 800 million people globally spend at least 10% of their household income on healthcare. And half of the world's population lacks access to essential health services. And 100 million people are driven into poverty each year by the cost of healthcare. So at the current pace, up to 1/3 of the world's population will remain underserved by 2030 with no access to basic healthcare. And so we absolutely need to act on this in order to reach the health-related targets of the SDGs by 2030. And universal health coverage is the only way forward. For everyone to be able to fully exercise their right to health, we must ensure universal access to good quality and affordable services. And this is what it was recognized at the 2019 United Nations high-level meeting on universal health coverage. But as a global community, we are not really on track to meet this goal. Surely proper funding is needed, but it's not sufficient. As I personally experienced with the Chiesi Foundation in Sub-Saharan Africa, we work particularly in Burkina Faso, Togo, Benin, and Burundi, and partially also in Central Africa. Low-income countries need, yes, financial, but also technical and political and managerial support to strengthen local healthcare systems, particularly primary healthcare, to educate and train healthcare workers, establish sound regulatory systems, and streamline supply chain, eliminates waste, inefficiencies, and corruption. And unfortunately, when it comes to global health, the political debate is often limited to the thought about affordability, price of medicinal products, and IP protection, but it's much more than this. And we must employ an holistic approach based on partnership, where all the actors of the healthcare system, from institutions to governments, from the civil society to NGOs, from healthcare professionals and patients advocacy group to industry, should be involved. So to put it simply, health is wealth. If we invest on illness prevention, immunization, basic healthcare, we can save a lot in healthcare costs and working days, and we can save lives and generate broader society benefits. So to conclude, universal health coverage should therefore be a priority together with climate change fight in the international agenda. Thank you.
Maria Paola, thank you very much.